Okay, if we continue the surgical safety principles to have a safe surgery and effective surgery, it has three components. The three components of this the successful surgery, it starts from pre-procedural verification of all documents. You should verify all documents and the patient. You should also verify the patient. The second thing is site marking. If especially if the surgery is occurring in some organs that the person have two, for example, right kidney and left kidney or right leg and left leg, you should mark the site of the surgery. The next thing, which is most important, is timeout. That some doctors they never call timeout during the surgery, but timeout is very important and it's important part for surgical safety, and it will save lives. So it's not an easy thing. The timeout and the participants of the timeout are all the surgical team, including the patient, the assistant, the surgeons, the scrub nurse, the runner, and the surgical assistants. So all the team should participate in the timeout. The timeout will start and one person will assign to call the questions and the other team members will answer. So the first question is the patient name and the procedure, and the patient should call his name or her name and the procedure that will be done. The next question is the site marked, then yes or no, or not applicable. Anesthesia machine is functional and it's checked and working, then the anesthetic team will say yes. Pulse oximetry is functional and on the patient, then it's yes. It's not only functional, but it's functional and on the patient. The other thing is the patient have any known allergy, then yes, which type of allergy and what does the patient have allergy, or mostly it becomes no. If there any anticipated airway difficulty or intubation difficult, if it's yes, are we prepared that, which equipment or which assistance we have? The other questions will be asked to the surgeon. For the surgeon, they will ask the surgery duration, the expected duration of the surgery or how long the surgery takes, the amount of blood loss, if the blood loss is more than any risk of blood loss more than 500 ml, and if it's yes, then what we have prepared. Do we have any blood for transfusion? Do we have a cross match was done, or these questions will follow. Then they will ask the surgeon, is there any anticipated critical event or complication? Like the surgeon may say the anticipated complication is organ injury. Which organ injury? Intestinal injury. Then which backup we have, or difficult extraction of the baby, or adhesion is. All the doctor will tell what the consent that he have, and the next question will be: are we prepared for that? Do we need any special equipment for the surgeon? Then for the nurse team, they will ask the surgical set or surgical site is sterile, or whether equipment is sterile, and check it, and it will be see yes. Then that's the main component of the timeout. Then at the end of the timeout should be done immediate before the skin incision. Then after the timeout, then you are ready to go, continue the surgery. The other thing that we need to know is the fire triangle, because you should control all your environment because there is fire risk in the operative room. And the fire triangle is the three components that needs to ignite a fire, which means ignition, oxygen, and fuel. So there's oxygen in the room, and there's fuel. The fuel can be alcohol or other fluids that's using for antiseptics. And there's ignition because you are using cotton and other electric devices. So fire can easily catch up, and most importantly, you should keep these three, not to use all three together, or they should not come in contact. So always when you are using surgical electrosurgery device, it should be off when you are not using, and it should be keep out or away from the other metallic parts in the surgical field.